I've learned that prostate cancer isn't just one disease. It's deeply personal. There's a mental component that comes. It has many faces. No two journeys are the same. Some men live with it for decades without symptoms. Others face aggressive, life-threatening battle. That reality hit me hard. I also learned that the way we talk about it or don't talk about it can be dangerous. Too
Absolutely.
many men ignore the signs. They avoid screenings. They assume it won't happen to them. I realized that early detection can mean the difference between life and death. Um, and yet so many men stay silent out of fear. To your point, there's misinformation out there. The silence is costing lives, especially in the Black community. There is no data that says why it's so prevalent, but we know that it's most prevalent in the Black community. I was shocked while going through my journey, realizing that Dr. Martin Luther King's son passed away from prostate cancer. O.J. Simpson, prostate cancer. I learned that prostate cancer is not a death sentence. From the time of diagnosis to being declared in remission, I would have to say that I learned that I'm stronger than I ever imagined, but also more vulnerable than I ever allowed myself to be too, because my vulnerability, it helps people. So talk to people about it. Cancer. It can strip away all pretense. There was a lady that I met while going through, who happened to be there same day, same time. I got a conversation with her as she talked to someone else who was going to ring the bell soon. Her name was Miss Morris, elderly, white, female. We had a conversation, and she said, "You know what? Cancer is the great equalizer. I've learned that everybody here, no matter which side of the building that you're going to, all of us are just human beings trying to take care of our family."
That's right.
And realizing that she had the same cancer that my sister was diagnosed with, but she didn't have the resources that Miss Mary had. And we became friends. She told me that I was the first black friend that she's ever had.
My goodness.
And to this day, we still stay connected. She brought me breakfast one morning. I had my daughter going in for therapy, and she brought me therapy. My daughter's like, "Who is this old white lady bringing you food, Dad?" And I said, "That's my buddy. That's Miss Morris." Um, she was always there by herself. On the day that she rang the bell, I brought her balloons and a card and flowers, and really made a big deal out of it. And that really, really stuck with her. And she said that cancer is the great equalizer. And I said, "Miss Mary, I understand the metaphor, but the truth is God is the great equalizer. And it's God that brought us together. And I'm so glad that I get to call you friend." And to this day, we are still friends. And I believe that she got a chance to look beyond what the media says about people, and to see the heart of God through me. And as a result, I have a really good friend named Mary Morris, who continues her battle. To your point you mentioned earlier, I said I learned that advocacy is not optional. Advocacy is not optional.
Thank
It
you for
is
saying that
survival.
again.
It's
Yes.
it's survival. No one hands us a perfect treatment plan, right? You had to push for answers. I had to ask more people. Ask experts that are in this area. Um, Open up. Don't be afraid to ask and tell people what you're going through, because I learned that I met men from stage one all the way to stage four, from radiation. I met guys who waited. I met guys who had radical surgery, and someone said that you will rise again. So that let me know that I wasn't alone. I had people that I could talk to, and I have since become the person that people can talk to about this. I learned that control is an illusion. We have all these plans, great intentions, but God is the master. He is truly, truly, truly in control. Days that I felt completely powerless, but I found peace and focus on what I control, and that was Him. I could focus on Him and His promises. That Deuteronomy 30:1 and 6, that He was not leaving me alone, that I didn't need to be afraid, that He would be with me. So Long answer to a short question, some practical tips, I would say. Break the silence, talk about it.
You are a powerful, powerful individual, a true man of God that is put here to be a light for others. And I can't thank you enough, Eric, for just coming on and sharing your story, sharing your testimony, and looking beyond just this interface, knowing that there's going to be thousands of men that are going to hear this and be activated to become engaged better in their health care, specifically around their prostate health. Eric Williams, thank you for being a guest on Genetics for Healthcare.
Hey, I appreciate you having me, but I would be remiss if I didn't really quick give these last few things. I would say for all the brothers that's out there listening, um, break the silence, talk about it, go to the doctor. Uh, 1 in 8 men will be diagnosed with prostate cancer. It's not a old man disease. If we don't talk about it, we don't catch it early. Start the conversation with your doctor. Don't assume that when you get your panel that box for PSA is always checked. Ask for it. Know your numbers. Know your risk. Just like if you're going to buy that new driver, buy that new television, buy that new car, you're going to do a lot of research about it before you make that purchase. Research those numbers, know your health. And last but not least, I would say be an advocate for yourself. No one else will. The biggest mistake you can make is assuming that one doctor's opinion is the only path forward. If something doesn't feel right, speak up. If your doctor tells you to wait and see, push for further testing or get a second, a third, fourth, fifth opinion. Your life is worth fighting for. No one's going to
Self-advocacy.
advocate for you but you.
No
Self-advocacy
one,
is it.